One of the biggest threats to health, of course, is cancer, and in the battle against that disease, there is a promising new tactic. It dispenses with the one-size-fits-all approach and tailors the treatment to the patient. We asked Dr. Jon LaPook to tell us how it works.
When Sheila Gallant was diagnosed with breast cancer nearly 4 years ago, it had already spread to her bones, liver, and lungs. Chemotherapy and radiation caused her hair to fall out and made her sick. But worst of all, the treatment stopped working.
I said, I have to try to fight this. I can't give up. I'm 40-something years old. I can't give up yet.
It takes 45 minutes to an hour to circulate.
Her team at Massachusetts General Hospital, MGH, offered her an experimental treatment based on a profound change in thinking, that each person's cancer is unique. Dr. Jose Baselga is chairman of oncology and one of Gallant's doctors.
Every patient will receive a different therapy that is more active, that is less toxic, that will improve the quality of life, and that will prolong their survival time, is what we are doing, and it's extremely exciting, and it's a whole new game here.
Here's how the game has changed. Researchers have identified hundreds of different genetic defects or mutations that help make each cancer unique. The idea is to identify a specific mutation and find a drug that targets it. In breast cancer, more than 100 mutations have been discovered. These mutations lead to defective proteins that make the cells replicate out of control. Targeted drugs hone in on those proteins and disable them, killing cancer cells while leaving healthy ones alone.
By identifying what drives every single tumor, we now can begin to have better therapies that are smarter.
MGH uses the world's largest library of tumor cells to study mutations and test new drugs.
What we've done here is set up a system that can detect the presence of 91 different mutations.
Dr. Mark Criss is chief of the lung cancer department at Memorial Sloan Kettering. He acknowledges only a small percentage of tumors have a mutation with a known treatment, and even effective targeted drugs may only work in a fraction of patients.
Even if something helps maybe by 10%, if that 10% includes the daughter's wedding, that's a damn big 10%.
In Gallant's case, doctors found a breast cancer mutation they could target with an experimental pill. She's been taking it for 2 months with no side effects so far.
So you're nice and straight. Your head is perfect where we want it. So
She's having regular PET scans to see how well the treatment is working. And tumors in her breast, liver, and lungs, seen here in black, are shrinking.
What went through your head?
Amazing. Totally amazing. It's how it was there before, and all of a sudden it's not there anymore. I found myself very fortunate to be here, and they picked this drug for me.
That's definitely an impressive early response, but one concern for patients like Sheila Gallant, cancers that seem under control can develop new mutations that make a therapy stop working. That's why researchers are constantly trying to find new targeted drugs so they'll have a backup plan if needed.
Promising steps. Thank you, Jon.